In this episode, we're discussing the advantages of bioidentical hormone replacement therapy. My guest is Dr. David Rosensweet, and he's just a great human being. I really enjoyed this conversation, and he's just so easy to talk to and so knowledgeable. He's a real resource. And you might be saying right now, well, Dave, I thought you were a naturopath. You didn't believe in drugs or pharmaceuticals. Well, generally, no, but they do have their place. If someone has made significant lifestyle changes and they are still experiencing symptoms of menopause, this might be something new to consider. Or you might have heard of a friend who has been doing hormone replacement therapy and got some benefit out of it, and you're curious, but you've heard that it could be dangerous. Well, Dr. Rosensweet answers all those questions and a whole lot more. So I encourage you to listen to this whole thing. It's a little bit long, but it's definitely worth hanging in there to the end and listen to the whole thing. This episode is brought to you by Fullscript, the only nutritional supplement source I recommend. If you care about the quality of what you put inside your body, get your supplements from Fullscript. There you can find a huge selection of professional-grade, third-party tested products. Go to my website, davidsandstrom.com/Fullscript. Click on the orange button, create an account, and you'll lock in a 10% discount for life. Welcome to the Natural Health Matters podcast, where it's all about maximizing your health potential so that you can look and feel your best at any age. I'm your host, David Sandstrom, naturopathic doctor and biblical health coach, and this is episode number 124. Today we have on the show Dr. David Rosensweet. Dr. Rosensweet is the founder of the Institute of Bioidentical Medicine and the Menopause Method, as well as the author of 3 books on the subject. His latest is Happy, Healthy Hormones. Dr. Rosensweet graduated from the University of Michigan Medical School in 1968. Early in his career, Dr. Rosensweet trained the first nurse practitioners in the United States and was in charge of health promotion for the state of New Mexico. He is nationally known lecturer and presenter at the American Academy of Anti-Aging Medicine, A4M, the American College for Advancement in Medicine, ACAM, the Age Management Medicine Group, and more. In 2019, he was called to Washington to speak in front of the National Academies of Science, Engineering, and Medicine on the safety and efficacy of bioidentical hormones. And he just told me that he just got back from Washington, D.C., doing a second talk up there, talking with our lawmakers and their staff about protecting the rights of practitioners that do hormone replacement therapy, as well as bioidentical hormones. Dr. Rosensweet trains medical professionals to master HRT using the most advanced and modern tools. His protocol has been used to treat more than 12,000 women. That's an impressive resume. Dr. Rosensweet, welcome to Natural Health Matters.
Thank you very much, David.
Well, it's a pleasure and an honor to meet you. I've heard about you. I've listened to you talk before, and I think you've got a really great message, very solid on the science end of things. So if you don't mind, why don't we just start off with the $64,000 question, and that is the elephant in the room. Is hormone replacement therapy dangerous?
No.
Okay, moving on. No, I'm just kidding. Yeah, so talk about some of the history behind this idea that it can be harmful to your health.
Yes, hormones have been used for over 1,000 years, and they got really popular in the 1940s in the United States when pharmaceutical manufacturers dried up the urine of pregnant mares that contains a lot of hormones.
Right.
And by 2002, 40% of American women in menopause were taking Premarin and Prempro.
Wow.
That was there was 18 million women who were doing that. It's the most popular and profitable drug of all time.
Wow.
And then out comes a false reporting of a large study. What was in the study was grabbed and blown up through the press, and false information spread. And the false information was that there was increased risk for breast cancer, heart attack, and stroke for women who were treated with hormones. The oddest thing is that it was well known that the hormones derived from horse urine, the estrogen portion, Premarin, it was right there in the study that there was a less risk, 21% less risk for acquiring breast cancer, heart attack, and stroke. It was right there in the study.
Wow.
And the part that was under question but was never really precisely defined was the Prem Pro arm. That was the combination of Premarin with an artificial hormone, the progestin, and it didn't have a statistically significant increased risk. In fact,
Mhm.
in the report, it said there was a 1.26 increased relative risk, but that was statistically insignificant.
Right.
Well, what we know in medicine and science is that means don't draw any conclusion, folks.
Yeah.
We don't have the data to back it up. But that's not how it was reported out. And it was almost an explosion of information, and it scared women all over the world. It scared healthcare providers,
Right.
and it was false information. And when I went in to read the study, I saw that it was false information
Yeah.
and was really concerned about it. But the cat was out of the bag. There was no stopping that one.
Yeah.
And the 18 million women that were being treated reduced to about the low millions, 1 or 2 million.
Wow. That's
That's how
staggering.
impactful it was.
So, do you think it was just bad science or bad reporting, or do you think there was some kind of a more nefarious agenda behind it?
That's really I've never seen anything like this happen in my whole career.
Hmm.
And you wonder how did this happen? Such a injury to women
Hmm.
event take
Yeah.
place, otherwise known as misogynistic event.
Hmm.
And the details of how that was misreported are excellently documented in a wonderful book that I recommend everyone read. The book is called Estrogen Matters. It's by Avram Blooming, an oncologist who specializes in breast cancer, and Carol Tavris, and they describe the details of how that error was made. Didn't matter, it was made, and it reduced the amount of women that were being treated.
Yeah.
And what I'd like to do is actually clarify the science.
All right. Please do, and I'll make sure to put a link to that book in the show notes. But go ahead.
That's great. In my book, Happy Healthy Hormones, in chapter 3, I go into depth about the actual science, and then I refer everybody to that book, Estrogen Matters.
Hmm.
And here's the actual science, which was known right out of the gate, right when it was published. But by 2006, that study committee continued to follow those women, and they saw that there was no increased risk at all. The 1.26 had reduced to 1. And in 2016, the same study committee that published in the exact same journal a retraction. They
Wow.
said, after 18 years of follow up, there is no increased risk for breast cancer, heart attack, or stroke.
Wow. But that didn't make it out to the headlines, did it?
That's the issue.
Yeah.
And hardly any providers, medical doctors, nurse practitioners even saw that or know that or are aware of it.
Hmm. Yeah. That's amazing.
So, to clarify the exact science around risk, well, for one thing, we're all at risk for thousands of diagnoses,
Sure.
and we're all at risk for hundreds of cancers. And as a male, for example, I'm at increased risk for prostate cancer. And this is rather new, and there's reasons for that. And women have a higher relative risk of getting breast cancer than they do other cancers. And this is brand new. When I was in medical school, that wasn't the case.
Hmm.
And there's reasons for those increased risks. But given the risk that we all have, the science is this. Women who are treated with hormones are at less risk for breast cancer, heart attack, and stroke than women who are not treated with hormones.
Wow. I'm going to repeat that. Women that are treated with hormones are at less risk for heart attack, stroke, and breast cancer than women who are not treated.
Precisely. It even
Wow.
goes a little farther. Women who do get breast cancer, they happen to have an increased risk, relatively speaking, for recurrence than a woman who has never had breast cancer of getting it.
Hmm.
But women who have had breast cancer and have had that breast cancer properly treated, they're at less risk for recurrence if they are treated with hormones than if they are not.
Yeah. Wow. That's pretty amazing. What percentage of women um, actually will come to you and say something along the lines of, I got my life back?
That's why I'm here today. Is I was a general practitioner, and by the time people come to doctors, usually there's a lot of water under the bridge,
Yeah.
and you get into these diagnoses, diabetes, obesity, and it's a slow moving train. But with menopause, you have a lot of basically healthy women. Okay, there's midlife mileage there,
Hmm.
but they fall off of a horse. And I'm here today because the very first patient I said, she told me she was going crazy. And this is a woman who retired in her 40s. She had been so successful. And we gave her some progesterone. And 3 weeks later, I get a letter from her saying, "Oh my God, I'm myself again." And those are the magic words.
Yeah.
And we hear them over and over and over again in one form. I can't believe this stuff. I'm so much myself again. I feel so good again. So it's because of the effectiveness that I got so interested. But you're a believer in the divine. So am
Yes.
I. I never really guided my practice. I always thought it was divinely unfolding, that there
Hmm.
was a power greater than myself that was really orchestrating
Amen.
where I wound up.
Yeah.
But a
I'm
lot of the
certainly with you.
reason that I had such an affinity to it is, oh my goodness, these are so effective and they can be so beneficial, especially as the decades go on.
Yeah.
Because I see what happens at the end, and people don't want that. People want to continue to be alive and
Yeah.
vital and active.
Yeah. And how does that make you feel when someone says that to you? You helped me get my life back. You turn my life around. How does that make you feel?
Well, it's magic. You're naming it. You see it.
Yeah.
It's what could be more rewarding when you actually assist another human being in a substantial way. It's right up there with the greatest thrills that there are.
Well, the Bible says it's more blessed to give than it is to receive, right? And that's what you're
Yeah.
doing. You're giving to these people. You're giving them hope. You're giving them vitality. You're giving them time with their family, more time to enjoy the things that they love, outdoors, sports, you name it. An active sex life. I mean, the list goes on and on. And
Yeah.
you're a very generous, giving person. I can see that.
As are you.
Thank you. Thank you. So I'm curious. You're kind of countercultural, right? You're kind of going against the standard medical model here. And I know you're an MD, and I know that with your extensive training, medical doctors come out of med school and kind of trust the associations that are associated with their industry, and sometimes kind of blindly, in my opinion. So, how is it that you made that transition to saying, "No, wait a minute. Even though my colleagues are not on board, I'm going to pursue truth here." I'd like to learn more about that process for you.
Well, my medical school was like a temple or a church or a synagogue for me, University of Michigan. It
Okay.
was really special. It was a sacred experience. And then
Hmm.
as a senior, we were given a 6-month course on the medical literature.
Okay.
And why'd they want us to do that? Because they were very aware that a lot of the medical studies that were out there were highly prejudiced by the money that could be made if something was endorsed by a study. And it was 6 months.
It's a long
I mean,
time.
there was other courses at the time, but
Sure.
it was a significant course
Yeah.
for us to learn how to read those studies and get clues as to about whether they were really good science or whether they were not.
Hmm.
And although I understand what your question is, I'm going to say I didn't go outside of the mainstream.
Is that right? Okay.
I stayed in the mainstream
I
of
got you.
my profound, excellent original education
Okay.
and followed the tenets that we were taught about how to understand studies. But it was as plain as day. I mean, if you read the study, the first thing you encounter, I was concerned too when I heard that how popular that fright came out. Came out.
Sure. Of course.
Right. So what did I do? I read the study, and I went, wait a minute. Right in the study, they're saying there's a less risk for women treated with Premarin, and they're saying that there's an increased relative risk, but it's statistically insignificant
Hmm.
for women treated with Prempro. And I went, come on now.
Mm-hmm.
this is not a good event. And plus, there's been hundreds of studies on this, and the European literature and the American literature have really been scrutinizing this topic for a long time. And this was the only thing that came up that adverse and within the study. So yeah, if you, I assert that I was following my training and
Okay. Very
following
good.
the best tenets of our
That
profession.
that makes good sense to me. And in defense of the MDs out there that are not on board with your message, they're busy people. They're trying to make a living. They're trying to run their practice, and they don't have time to really dig deep into every study that comes out. So what do? They glance. They read the headlines and they read the abstracts, and maybe not pay attention to the details the way you did. So hats off to you for doing that. That's great.
Yeah, and there was a reason for it too. I mean, you're so right that medical doctors are so busy,
Hmm.
and they have an opportunity to stay in their own lane. And if they can, they have a chance of getting their arms around the tremendous amount of information that's coming in their specialty:
Right.
urology, internal medicine, endocrinology, obstetrics, gynecology. When something comes out that's not part of their expertise, they do what you do. They get exposure to reputable journals. That's the Journal of the American Medical Association. That's a reputable journal.
Hmm.
And they just don't have the time,
Right.
and their societies are not necessarily zeroing in. And so that it gets intricate in there.
Yeah.
Why it
Yeah,
took
well, it's
such a
totally
turn.
understandable for sure. So, for those listening that may be new to this idea, what do hormones do in our bodies?
Well, we got thousands and thousands of biochemicals floating around in our body doing a lot of stuff. And the most powerful of them are the hormones.
Hmm.
And there's reasons for that. They're really guiding core functions like the hormones can be mobilized for fight or flight from a saber-toothed tiger. These are very historical for us. There was a time we had to run or
Right,
fight.
right.
And so there's tremendously energizing
Hmm.
and instantly energizing. So they're the most powerful. And they
Hmm.
also relate to reproduction. And they're so pervasive, they relate to clarity of thought, to the health of the bones, health of the arteries. They're so profound that they have all these other functions that people may not necessarily be as aware of.
Hmm.
So what they're doing is it depends on what they're called to do. From a woman's ovary or from a man's testicles, these hormones are called primarily to energize and give motivation and give clarity of thought. That's a funny thing to say first about estrogen and progesterone and testosterone.
Mm.
They're there to support the muscles and the strength of muscles and the building of muscles. Without them, people lose their muscles, men and women. They're there for the health of the bones. Without these hormones, the bones lose their strength and you can get fractures really easy. They're there for clarity of mind. You lose those hormones, and a high percentage of women have cognitive challenge midlife.
Hmm.
Arteries, the health of the arteries. We know for sure that young women very rarely have cardiac problems.
Right.
The incidence of heart attack in young women is much lower than it is in young men. And the reason is estrogen. And when they lose their estrogen, the incidence equalizes about the age of 60. You never hear of a
Okay.
young woman in her 40s, totally mysterious, passed away from a heart attack, never sick a day in their life. That happens to young men.
Yeah.
Yeah, it's estrogen protection. And the list goes on and on and on of what they do.
Yeah.
And when you lose them, what they put us at risk for, well, the most that they put us at risk for is assisted living facilities and nursing homes.
Yeah.
We have experts in this area, gerontologists, and then one of them was worked in a with nursing homes for decades. I asked her, what percentage of men and women do you think are in nursing homes because of loss of hormones? And she said 80,
Wow.
80%.
That's
The
staggering.
flip side of that is 80% of those entries could be probably or possibly prevented by replenishing of hormones properly over the course of their life. And it's really around the muscles and the bones. A gerontologist in 1968, and if I go too deep in the weeds, David, please stop me, okay?
Oh, feel free.
A gerontologist, an expert on aging, gave a lecture to our senior medical school class. And the essence of what they said was, you are medical students, you know thousands of diagnoses. Let me tell you what's happening to older people. They're losing their muscles. It's called sarcopenia. They can't stand or walk with stability. They fall on their osteoporotic bones,
Break a hip.
and that fracture usually leads to death.
Yep.
And then they also lose their cognitive ability. You want to do something for these folks? Protect their muscles, their bones, and their brains.
Which is what hormones are responsible for.
They're one of the major things.
Yeah.
That without them, let's put it another way, without them, the compromise there can be very significant, enough to put you in a nursing home or assisted living. You know, canes, walkers, wheelchairs, that's the progression.
Yeah.
Adult diapers fit in there as they lose bladder control. So these are all hormone related. On a more practical level, and for a woman in midlife, she'll start getting hot flashes in the middle of the night, and she won't be able to sleep. You know, we all know what losing a couple nights sleep is like.
Yeah. Rough.
And then she'll get vaginal dryness, vaginal atrophy, pain on intercourse, lose her libido. Men commonly, we lose our libido when we lose testosterone. We lose our drive. We lose our core motivation, inspiration. So this list goes on and on and on. Mood disturbances, depressions, anxieties, because these things are so powerful and they're so all over us, ubiquitous.
Yeah, you know, it brings me back this memory. I used to live in South Florida. I know you live in Southwest Florida, correct? Yeah. So we had a boat, and I had a friend of mine who was really into fitness. It was before I really got into health and wellness. I didn't know much about any of this, but we were out in the ocean, and it was a nice, calm day. I said, "Hey, let's just head east. We'll go to Bimini. Let's go over to Bimini, do some fishing over there." So we did, and we're on the way back. The wind started picking up, it was a little rough. Like, we got a long way to go now to get back. And he said, "You know, Dave, that whole idea you had about going to Bimini today, that was testosterone based. You know that, right?" So, well, yeah, probably. So it does. It affects us in a lot of different ways. You know, it really does. We made it back safely, obviously, but I've got a lot of questions I want to ask you, and one is, of course, our hormones are going to decline with age, right? But it seems to me, because we're living in such a toxic world, that we're seeing an unnatural decline in a lot of people. Would you agree with that? We all want to age gracefully, right? To do that, we need to maximize our health potential. To that end, one of the top challenges is the fact that today's food supply is compromised, and it's getting more and more difficult to get all the nutrients we need from the food that's available. That's why I recommend adding quality nutritional supplements to your routine. Now, there's a lot of choices out there, but keep in mind, where you get your supplements matters. There's very little oversight in the supplement industry, so because of ignorance and or unethical practices, a lot of products sitting on the shelves at places like drugstores or warehouse clubs are compromised. The only source I recommend is Fullscript. When I want supplements for my family and me, I turn to Fullscript. They only sell through healthcare professionals such as myself. So if you want quality supplements that actually work and a label that matches what's inside the bottle, look no further. Go to my website, davidsandstrom.com/Fullscript. Use my link to create an account, and you'll get instant access to dozens of professional-grade supplements as well as non-toxic body care. The vast majority of Fullscript's offerings are not available at the retail level, and they're third-party tested for quality. All delivered directly to your door, and right now they're offering free shipping on orders over $50. If you use my link, you'll lock in a 10% discount for life. You've got nothing to lose. Act now. Go to my website, davidsandstrom.com/Fullscript, click on the orange button, create an account, and you'll get instant access to all my favorite products as well as my recommended protocols. And you'll be one step closer to looking and feeling your best. You won't be sorry. That we're seeing an unnatural decline in a lot of people. Would you agree with that?
Absolutely, 100%.
Mm-hmm.
When I was in medical school, the sperm counts were about 10 times what was considered normal, what they are now.
Mm-hmm.
And there was a study done on Florida alligators.
Okay.
That there was a lake on the East Coast there near the lake. It's a big one. I forgot its name.
Like Okeechobee?
Yeah, and they saw that the alligators were not reproducing like they used to. And there was an actual scientist went and did a study, and they saw hermaphroditism occurring at a far greater rate, sex change,
Wow.
female to male, male to female.
Wow.
Sperm counts in alligators were way down. That's why they weren't reproducing. And there was even changes in the genitalia. And what was the cause of that? So many of the herbicides and pesticides that are derived from petrochemicals, of all the things that they could do, they affect hormone receptor sites. What else? You think they could do something else? Well, they probably do, but they definitely affect livers and brains, but they also affect hormone receptor sites. And so that's the science behind these concerns you have. And we're seeing it in young men. We're seeing young men in their 20s and 30s getting interested in testosterone treatment, not just necessarily to build muscles. Young men in their 30s and 40s losing their drive, their motivation, their libido, and their erection.
Yeah. Yeah, that's unprecedented. I mean, I've been around as long as you have, but I'm 61 years old. And when I was a kid, it was unheard of. You didn't hear anybody in their 20s
No.
not going to a hormone replacement. It was just, wouldn't cross anybody's mind. Bodybuilders, maybe, but not your average guy. So here's another question I had. Did you have any other thoughts on that, or that was pretty thorough?
No.
Okay. Another question I had was, what's the difference between a bioidentical hormone and a traditional pharmaceutical hormone?
Well, the original hormones that were being used by the Chinese about 1,000 years ago, what they would do is they would collect the urine in separate buildings from young, healthy women for women and do a separate collection for young, healthy men, and they dry it out. And they did that because hormones are in that urine.
Mm-hmm.
In fact, the exact hormones that are in young women, so they're molecularly identical in the urine.
Okay.
And then over time, the pharmaceutical industry needed a much better source, and it invented collecting the urine of horses because there's a lot of hormones and there's large volumes of urine, especially.
I was just going to say that when a horse pees, they have a lot of volume there.
That's right.
Yeah.
And they would catheterize these horses and collect that urine.
Mm-hmm.
Well, 50% of what's in a horse urine is it's native to horses only. The human females have never seen it. So those are not molecularly identical hormones.
Okay.
And then they started working with synthetic hormones, like for birth control pills. For example, there's an estrogen and a progesterone in the birth control pill, but it's not identical. Molecularly, it's different. For example, in birth control pills, it's called ethinyl estradiol. It's got one of the hormones in there, but it's attached to this molecule that does not exist in the human body. And it's got an artificial progesterone in there. It's not a progesterone, it's progestin. So the molecules are different. So in the early 1980s, two human beings in the United States independently knew that there was pure hormone available. One was a pharmacist outside of Dallas, and the other was a holistic medical doctor, a real pioneer, Jonathan Wright, in Washington State. And they both had the idea, we know that they're getting a pure form, a molecularly identical form, in the process of producing the estrogen for birth control pills. Why don't we get that? And sure enough, the pharmacists found the source of the same molecule. So they started putting it up in gels and creams and even capsules. And the molecule that's in these creams, of the estrogens, for example, commonly there's 2 estrogens in a cream that women use. Well, they're the same molecule that's in the female body. There's no difference.
That's really
They're
good.
derived from plants. The pharmaceutical manufacturers own soy fields. That's one of the more common sources of it, and they're exquisitely biochemically altered to derive the exact same hormones in the human body. And the
So
same for testosterone. And
the ultimate source is soy.
well, they're in a lot of plants.
Okay.
They're in yams, for example, very plentiful.
Hmm.
But as far as mass production goes, a lot of this is being originally derived from a molecule that's in soy called diastenin, and it's converted very skillfully into pure estradiol, pure
Okay.
estriol, pure testosterone,
And the
pure progesterone.
molecules are identical to human hormones.
That's right.
Yeah. So you have to go to the right pharmacy to get a pure product. Do you not?
That's right. And there's 7,500 of them in the United States.
Hmm.
They're all pharmacists were this type of pharmacist originally.
Yeah.
They were compounding pharmacists, they were called.
Hmm.
They took the basic ingredients and put it up in creams and gels and ointments and stuff. But then a big change occurred when pharmaceutical manufacturers started mass producing these pills. And I have nothing against them. I'm on a pharmaceutical pill myself,
Hmm.
but their expertise is not the hormones.
Yeah.
But these
It's a
compounding bioidentical hormone pharmacists, that is their expertise.
yeah. Got you. So how do you go about finding a reputable pharmacy?
Well, if you just Google compounding pharmacy near you, you'll pick up 3 to 10 of them, depending on where you live, because the pharmacists that are most interesting and most interested in making up these individualized, precise prescriptions, they're all over the place. And you can go to different websites, the Alliance for Pharmacy Compounding. That's what I went to Washington with.
Okay.
The PCCA, the Pharmacy Compounders of America. There's once you are curious about where are these folks, and you start Googling them, you're going to find, oh my God, they've been down the block from me. I didn't even know it.
Wow.
They were just called a pharmacy, right?
Yeah. 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 Uh-huh. Okay.
Physicians know how to find them.
Yeah. Well,
Any
that
physician.
brings up my follow-up question was how do you find a physician that's trained? I know you're training doctors and nurse practitioners in how to do this. Do you have a practitioner locator on your website?
We I'm going to back up a little bit and say this is a very unusual field. I grew up in an era where generalists, like general practitioners, were differentiating out into specialties. So
Hmm.
you had surgeons becoming orthopedic surgeons or obstetricians and gynecologists, and internists becoming neurologists, and specialization started occurring,
Yeah.
but not in the world of hormones. At the time that specializations were occurring, and they're really excellent. I mean, this is a great thing. These specialists are really trained; they get very advanced training. But it didn't happen in hormones, and a lot because of that Women's Health Initiative study. It scared everyone away from it. So what I'm really pointing out, it's not that easy to find people who are taking this on as a specialty. And
Hmm.
yet, the body of knowledge and the intricacy and individuality of human beings calls for it being a specialty.
Yes.
And that's one of the only differences between myself and a lot of others in this field is 30 years ago, I decided I got to specialize in this. There's way too much to learn. How do you get good at something? You
Hmm.
zero in on it.
Hmm.
And so that's what we've been doing. And so we've trained 600, 800 physicians. And if you go to our website, you can put in an inquiry to see if there's someone we've trained. So that's one way that the public can identify people who are taking this on as a special caring and special. And then another way is there are so many compounding pharmacists everywhere in the
Yeah.
USA
Hmm.
that what I suggest is you find the one that's in your area or the 2 or 3 or 5, and you actually walk into that pharmacy and ask to talk to the pharmacist. If you try and do it by phone, these are busy folks. They're not likely to reveal what they know. But when you walk in, these are very friendly folks, and you ask them, you're the ones who are receiving the prescriptions. Is there anyone that you would recommend that I go see who really cares about this, who's really doing the best work? Because they know it.
Yeah, they'll know the
They're savvy
practitioners in their
enough to
area.
know who's writing sophisticated prescriptions and precision individualized prescriptions and
Yeah,
who's just doing sort of general stuff.
yeah,
So those are two ways to do it.
that's a great
There's,
suggestion.
yeah.
Very good. So, talk to us about. I'd like you to say a few words about the woman who maybe is perimenopause or is in menopause and not really experiencing any negative symptoms. What would you say to that person? Can you make a case that she should still be pursuing an endocrinologist and talking about this?
Well, I want to back up if I could, David.
Sure.
The question you just asked previously, how do I find one of these folks,
Hmm.
is the most important question. Because bottom line, you're going to need someone who can write a prescription. and,
Right.
you want that person to be really trained.
Exactly.
And that's the job of every woman and man who wants to pursue this, is how do I go shopping for the physician or nurse practitioner that really cares about this and is expert in it?
Yeah.
And that's the only job, really. I mean, I wrote the book for women. We're in the process of doing the same for men. But there's only so much you need to know. What you really need to know is who is the right person for me
Yeah.
that I can like and trust. And I forgot to leave out another resource, is ask your friends, because
Okay.
they may not be publicly announcing it to you. But if you start asking around, you're going to learn that one of your compatriots is seeing someone for hormones. And
Hmm.
you ask them, do you like them? How you doing? So that's another third resource. So sorry to back away from the next question that you asked.
Not a problem. So let's review here. So, how do I find a practitioner? One is your website.
Yeah.
Another is find a compounding pharmacy in your area. Go walk in and talk to them face to face. They will know the good practitioners from the mass market, so to speak. They'll be able to point you in the right direction. And then the third is help me out here. What was the last one you
Ask
just
your
said?
friends.
Ask your friends. Yeah, yeah, very
Someone
good.
is getting hormones and they may not have told you.
Yeah, right, right. Which would be very common, right? People don't generally talk about that at parties.
Exactly.
Yeah,
And this day and age, it's so much easier because many elements of medicine really call for an in-person visit to the physician.
yeah.
Not menopause medicine does not. I mean, you can't do surgery by telemedicine. You
No,
can do follow up, but you can't do the surgery.
right.
But menopause and andropause medicine lends itself beautifully to telemedicine.
Yeah,
So you got access to someone who's licensed in your state.
yeah.
So there is going to be a choice there. You'll be able
Hmm.
to find something good.
Hmm. So you
Now,
develop. Okay, go ahead. I'm sorry. Go ahead. I
you go
interrupted you.
ahead, please.
Well, I was going to say that. Well, we had that other question, but you've developed a method called the menopause method. And
Yeah.
so, what makes your method different from the average, let's say, family practice practitioner that may be just kind of dabbling in this a little bit?
Well, I know we call it a method, but I think the only thing that it really is if you pay very, very close attention to what's going on for 30 years, you start seeing the natural process and how to address it. It's like anything. If you pay great attention to a sport, what's one of your favorite sports? Sailing?
I like baseball,
If you pay a lot of attention to baseball and you do a lot of practice, you start seeing how the game works.
right?
And you could say, well, this is the David method of playing baseball. Yeah, this wheel has been invented. It's baseball itself
Right, right, right.
that will tell you the proper way to address it if you pay close attention.
Hmm.
And so many people do to baseball. Man, there's a lot of science in baseball. Have you seen Moneyball?
No, but I had that recommended just last week. Somebody told me to watch that.
Oh, watch it. If you're a baseball fan, this is one of the best.
Okay, I'll check
all
that
the time.
out.
Yeah.
Very
Well,
good.
that's what I feel like we did with menopause and andropause, is there was very little known. There was no specialization. And I just started paying attention and teaming with women and teaming with men. I knew a lot of the science. And because women and men were so individual, like some young women, they need this much estrogen, so to speak, to be fertile, to get pregnant, to sustain that pregnancy, to have regular periods. Whereas other women need 3 times that much.
Yeah.
And then there's everyone in between,
Hmm.
individuals.
And you
Yeah,
learn that by talking to them and about their symptoms?
that's part of the way you do it. And then there's 3 different hormones we're talking about with women. And they can be low in estrogen, high in testosterone, medium in progesterone, high in estrogen, rich in medium in testosterone. There's all kinds of variations.
Hmm.
So the key to understanding how to do excellent medicine is to pay attention. And yes, start with symptoms. Because, and this goes back to the question you asked just a bit ago, 86% of women in midlife, they get life-stopping symptoms. This is known by scientific studies.
Wow.
This is not a quiet thing.
Hmm.
There are, I'm sorry, it's 84. There's 16% of women that have no symptoms. They're the ones I'm most concerned about. The 84%, they're so motivated they need help and they know it.
Yeah.
And so they reach out for the expertise. The other women say, "What's the big deal? Menopause is easy. And yet they are subject to the same bone loss, same muscle loss, same cognitive loss. So the symptoms are what inspire women and men. Men lose their erection, they lose their libido. That's what's inspiring them
Right.
to reach out for help and knowledge.
Right. That brings up another question I had is should men be pursuing hormone replacement therapy as much as women?
Absolutely.
Yeah.
All women and all men, we put out the maximum amount of gonadal hormones over your testicle at the age of 20, plus or minus a couple of years.
Yeah.
And then all of us decline.
Right.
Midlife, women take a drastic drop and they stop menstruating because they lose so many hormones. Men tend to be more gradual, but some men are declining early. In their 30s, they're already having erectile issues.
Yeah.
Some men decline slower, but it's 100% of males and females, we lose our hormones.
Hmm. So, we touched on this earlier, but it's kind of related question. We talked about how our hormones do decline with age, and we're not talking about if you're 60 years old, you're not talking about restoring your hormones back to a 19-year-old level, correct? We're just bringing them back to where hopefully someone will be asymptomatic. Is that correct to
Yes,
say?
that's exactly how we like to do it.
Hmm.
Now, in most cases, but not all, let's say for women, we don't want to restore youthful levels
Yeah.
because youthful levels do something called stimulate the breast to prepare for breastfeeding every single cycle.
Yeah.
And most women know that their breasts feel fuller as the month advances.
Right.
There's actual new cells there. There's been cell division there. This is preparation for breastfeeding during each period. If
Yeah.
you don't get fertilized, then everything rescinds and you lose all those new cells. But that's a very vulnerable time for cells, is when they're dividing. So we
Mm.
don't want cell division to be taking place in a menopausal woman.
Okay.
So if this is the range that I was talking about, healthy for young women, 20 to 29.
If you're listening on audio, Dr. Rosensweet has his hands up at about a foot apart, and one hand is about a foot higher than the other. But go ahead.
Thank you. And then what I'm doing is I'm dropping that upper hand because the proper treatment zone for most women in menopause is right below that youthful level. You can get everything you need: libido, vaginal health, bone health, cognitive health. Most women can get that and not do breast glandular cell proliferation at all by excessive amounts of estrogen. Now there
Yes.
are exceptions. In the world of dementia, sometimes women really need robust levels to get back their brain.
Mm-hmm.
Some women need a real lot to get back their brain, but it's so wonderful that they do. And some of them will get their period back. But these are rare exceptions.
Yeah.
Most women, if this is young, healthy, it comes in right below that.
Yeah.
So you don't get that monthly or anytime extra cells being dividing.
Mm-hmm. Very good. So here's another question I wanted to ask you before we wrap up, and that is, what's the best way what form is the best for doing the hormones? Is it a lotion? Is it a pill? Is it an injection? What in your opinion is the best way to do it?
There's a lot of different ways that work. And then there's the good, and then there's the great. And I think you're asking about the great.
Sure.
So for women, the estrogen and testosterone, and women definitely need testosterone. Women have more testosterone than they do estrogen. They definitely need testosterone to preserve their muscles. For women, the estrogen and testosterone is safest and most effective when it comes in as a skin application.
Okay.
The traditional ways that that's done is through a cream and gel. However, those creams and gels are solvents. So 18 years ago, my team and we developed a way to put it in an organic oil base. And there
Okay.
is no solvent in that. So certified organic oil, the hormones are floating around in that.
Okay.
And that's the state of the art to me. I love that. And same for men. I mean, the best way to do testosterone is on a daily application. This is what I do every day.
Okay. So
I
would you
do,
put it on your palms or the soles of your feet, or where would you
yeah,
put
I
it?
draw up the right amount with an oral syringe.
Okay.
This is an oral syringe. I squirt it out onto my hand
Yes.
right after a shower. I rub them together and I rub it on my sides
Okay.
until it gets dry, which is very quickly.
Okay.
And I do that every single day. And daily application is the optimal. That's what the body does. The body does
Right.
daily output. Traditionally, with men, you can also get testosterone through injection, but there's issues with that. But if it was the only tool I had, I would definitely do the injections.
Sure.
But it's not state of the art. Daily application of a topical is the best.
So when you do the injection, you get maybe your once a week or so, and then your testosterone will spike and then gradually diminish over the course of the next week, and then you go in for another spike. So you're talking about just more steady state levels that your body would do naturally.
And there's issues with spikes. You named it exactly, David. The body, when you spike, you get some interesting information going into the brain. You're going to get likely an increase in red blood cells. That's not safe
Hmm.
in the long run.
Hmm.
The spikes is not what the body's used to. So you're so correct. It's the daily steady state that we
Yeah.
like to have.
What do you think about the pellets? That's been kind of popular these days.
I'm very concerned about them. There's been a tremendous amount of errors made with the pellets. When I testified in front of the National Academy of Science, this was their biggest bugaboo. They had gotten a lot of reports that people who were on pellets had a lot of trouble. I think in the hands of an expert, they could be reasonable. But once again, they're not physiologic. You get these high levels, they last for 3 months or so. Yeah. Well, that's not physiologic to do that. You could say, well, it's sustained release. I've yet to see a study where the levels are steady state. There's complications with pellets. And I think the biggest issue is there I haven't seen many. Well, we see the fallout from pellet failures. So we see the women and men who are complaining about them. There's probably some women and men who are done decently with expertise, but I don't run into them. And I have definitely run into the pellet complaints. And they tend to use testosterone in women at very high doses, super physiologic. So I am not a fan. And
Yeah.
it makes us vulnerable. There's forces that want to eliminate bioidentical hormones, and pellets is the weakest link.
Is that
They're
right?
weak, yeah, they're the one. It's that area where there's been enough trouble and enough trouble reported that we're very vulnerable there.
Hmm.
So I
Well,
am not a fan of pellets.
all right. Very good. Thank you for that. Well, I didn't mention this. I probably should have mentioned it at the top of the show, but here at Natural Health Matters, I want to help you maximize your health potential so that you can look and feel your best at any age. And I think what Dr. Rosensweet is talking about here is really squarely in the middle of the bullseye here, as far as aging gracefully and maximizing your vitality and your enjoyment of life in your later years. As opposed to, as you said earlier, getting osteoporosis and muscle atrophy and having a fall and ending up in a nursing home before you should be there, or assisted living way before you should have been there. And I think that's a pretty important job. Thank you for doing what you're doing.
Welcome, David.
So I know you have a generous offer for the audience. Talk to us about your new book.
Well, it's the 7th edition. It's Happy Healthy Hormones. It's written for the women, and there's a lot of them who really like to know some things about it, really like to know the details, really like to understand what's going on. And your program can offer a link to a free PDF copy of that. So however you post that in your program.
Well, I'll be sure to put that in the show notes. People go to my website and click on the link. It's davidsandstrom.com. I'm not sure what episode this number this is going to be just yet, but davidsandstrom.com/the episode number. But once it's published, we'll have that number determined. What I'd like to ask you before we wrap up is, if you had to summarize what we talked about today, what's the most important thing you want people to know?
That we like to live long and walk and talk and take advantage of the wisdom and experience that we have. And as a physician, what I see actually takes place is that people lose their energy, their drive, their libido, their intimacy over time. As a physician, I see people of all ages. And when you start getting into the 70s and 80s, you start seeing major compromise. And so much of that compromise can be avoided by taking some care a little earlier. We recommend you get treated whenever it comes to you to do so, even in your 70s and 80s. But it's easier when you start earlier, and you're going to want to walk and talk and think clearly and be stable on your feet when you're 80 and when you're 90.
Yeah.
So it's almost not going to happen for most people unless they get hormone replenishment.
Yeah.
And you're going to want to not leave your family home. We know this so well. I've been a part of those transitions with actual patients. Women and men are strong. They'll do it. They'll go into an assisted living facility or a nursing home when they need to. But it's a heartbreaking moment for many of them.
Absolutely.
So what gives you the best shot of being active and sexually active, intimacy active, strong, playing things, getting down on the floor with your grandchildren, or your great-grandchildren?
Yeah. Amen.
Almost everyone's going to need hormone replenishment to do that successfully.
Yeah. Yeah. Very good. All right. Well, thank you so much for your time today, Dr. Rosensweet. And what is your website?
Well, there's several of them. For professionals, it's iobim.org, iobim.org. For the public, it's brite.live, bright.live.
Very good. All right. And if someone wants to get a hold of you personally, just through the website, or what's the best way to do that?
Okay. We have a team there, and
all
they
right.
can get through to me. Yes.
All right. Very good. Dr. Rosensweet, thank you so much for sharing your wisdom today.
David, it's an honor and a pleasure to be with a good man, and you just radiate it, and so it's a privilege, and I thank you, and I thank you for what you're doing.
Thank you. For more, go to the show notes page at davidsandstrom.com/124. There you can find a video as well as an audio version of the podcast. And I always put links to all the resources that we mentioned. And while you're there, don't forget to grab your free copy of Dr. Rosensweet's book, Happy Healthy Hormones. There's a link in the show notes page. You know, the number one way someone finds out about a podcast is a friend tells them about it. Natural and holistic health from a biblical perspective is pretty hard to come by. So if you have a like-minded friend who cares about their health as a follower of Jesus Christ, I'll bet they'll thank you for telling them about the show and sharing it with them. That's it for now. Thank you for listening. I'll talk with you next time. Be blessed.